What happens when you give creatine to Alzheimer's patients? Researchers actually tested this. 20 grams a day for 8 weeks straight. And the brain scans at the end of those 2 months showed something nobody was expecting. When I first came across this, my reaction was basically, why would anyone even try that dose? Most people who use creatine for the gym take 3 to 5 grams a day. This study went way beyond that. So what were they actually chasing with a number that high? The answer has to do with how the brain protects itself. There's a strict checkpoint called the blood-brain barrier, and it blocks most substances from getting in, creatine included. Regular gym doses reach your muscles just fine, but they barely make a dent in the brain. That's exactly the problem this study was trying to get around. Up until now, almost all the creatine in Alzheimer's research had been done in mice. Lab cages, promising theories, and basically no human data, which is what makes this study different. For the first time, creatine was actually tested on real Alzheimer's patients. And these weren't people with mild, occasional forgetfulness. The average age was around 73, and most of them had an Alzheimer's diagnosis already confirmed by clinical lab work. The researchers weren't even trying to prove creatine works as a treatment, at least not at first. Their real starting question was simpler than that. Is it even safe and doable to run a high-dose trial like this in older adults with Alzheimer's? Once the results came in, though, they ended up with a more interesting picture than they'd bargained for. There were 3 things the team was tracking at once. Could patients actually tolerate that high a dose for 2 straight months? Would the creatine cross the blood-brain barrier and reach brain tissue, or just circulate in the blood? And the one everyone actually cares about, would memory change at all? On the first question, the results were better than expected. 19 out of 20 patients stuck to the protocol, hitting at least 80% of their doses. For a group this hard to track, people with cognitive impairment, that's a genuinely strong compliance rate. Kidney safety was the researchers' biggest worry going in, and that part turned out reassuring too. A handful of people had mild cramping or stomach upset. Blood tests showed a small bump in serum creatinine, which is a normal, harmless response anyone taking creatine would show. Nobody dropped out because of side effects, and there was no sign of real kidney damage. That still left the big question open. Did any of it actually reach the brain? To check, researchers used magnetic resonance spectroscopy, a scan that can measure concentrations directly inside brain tissue rather than just the bloodstream. After 8 weeks, they scanned again. Brain creatine levels had gone up by about 11%. On its own, that number doesn't tell you much. More creatine in the brain doesn't automatically mean better memory. And figuring out whether it did was the next piece of the puzzle. Your brain burns through more energy than any other organ you have. In Alzheimer's, that energy system slowly breaks down, and cells end up starved of fuel. Creatine works something like a backup battery at the cellular level, helping keep energy production going. So did that backup battery actually translate into better memory? Here's what showed up in the data. Statistically significant improvements in working memory, overall cognition, and a reading recognition test. I'll be upfront about one thing though. The most widely used memory test out there, the mini mental state examination, showed no meaningful change at all. Flat. It'd be easy to leave that part out, but an honest read of the results has to include it. Dig a little deeper though, and a pattern shows up. The patients whose blood creatine rose the most also had the biggest jump in brain creatine. And the ones with the biggest brain creatine increase were the same ones who improved most on the reading test. That's not proof of anything by itself, but it's the kind of signal that makes researchers want to dig further. One important detail, this wasn't placebo-controlled. Every single participant got the real supplement. When you give someone the same test twice, 8 weeks apart, scores can rise just because they're now familiar with the test, what's usually called a practice effect. The researchers themselves said as much. These results aren't proof of a cure, just a promising early signal. So why did a study with this many caveats still make headlines? Because in Alzheimer's research, an honest, promising signal is rare. Most trials in this field end in disappointment. Treatments that look great in mice routinely fail once they're tried in people. That's why scientists stay cautious about early human studies like this one. There's a huge gap between it works in a mouse and it works in your mom. And this study is one of the first real attempts to close that gap with actual patients. That's the real reason it got attention. If someone you love is living with Alzheimer's, this research is genuinely encouraging, and there weren't any major short-term safety red flags. That said, this isn't an approved treatment protocol in any medical guideline. So should a healthy person start megadosing now, just in case? Honestly, we don't know yet. One thing worth being clear about, the 20-gram dose here was a research protocol, not something to copy on your own. The standard 3 to 5 gram daily dose is still what's backed by decades of safety data. Some people do get water retention or stomach issues at higher doses. And if you've had kidney problems, gout, or kidney stones, talk to a doctor before changing anything. What's the takeaway then? The big one is simply this. For the first time, creatine was actually tested in Alzheimer's patients using real human data instead of mouse models. That alone isn't a cure, but moving an idea out of the lab and into real patients is still a meaningful step forward. Right now, there's zero proof that creatine cures Alzheimer's. It's way too early to say that. But we're not just theorizing anymore either. There's initial human data now, and it needs bigger trials to confirm or disprove it. Maybe those larger studies won't hold up. Maybe they'll make an even stronger case. Nobody knows yet. But this moves the conversation from pure speculation to actual evidence, which is how science is supposed to work. If bigger trials do end up backing this up, creatine could turn into one of the cheapest, most accessible options ever studied for Alzheimer's. That possibility alone is probably what has researchers most excited. So no, the message here isn't go take 20 grams of creatine tomorrow. It's that science finally put a long, unanswered question to the test in real people for the first time, and the results are worth paying attention to. There's still a catch most people miss though, because the real question isn't, does creatine work anymore? It's who it's actually right for and who should stay away from it. That's what we're getting into next time. Who shouldn't take creatine past 50? Which medical conditions call for real caution? And when talking to a doctor, stops being optional. All based on the latest clinical data. Take care of yourselves. Take care of the people you love. See you in the next one.